The American Spine Center. Excellence in pain management.
I've had back pain now for a number of years. Lower back pain. Not too bad, but manageable. But in the past 2 years, it's become worse and worse and worse. Up to a point of almost, I think it was 8 months ago, it became unbearable. So things like just walking became very painful, standing became very painful. I couldn't walk for more than 10 minutes at a time. If I was out shopping with my family or friends, I'd have to sit down for a few minutes just to rest my back. The pain would extend into my right thigh, so it meant I was limping all over the place. So it became quite painful. And in my course of work, I have to go out and meet different people, go to different appointments. So it made just daily living quite unbearable. So I've been seeing a GP and been going to a chiropractor, and my GP eventually said I should try and go and have an MRI to try and find out what was the real root cause of the problem. And then I went to a hospital, saw a specialist there who diagnosed a number of my vertebrae, and the discs in between had degenerated, and that's when I met Dr. Hassan Sheikh, because I was advised to go and see him.
Paul is a 59-year-old gentleman. He suffers from severe pathologies of his vertebral canal and vertebral bodies, and also the disc problems. First time he saw me, he was suffering with main problems at L4-5 vertebra, L4-5 disc, and which was confirmed on the MRI scan. And the other disc which was causing problem was L3-4, but he also was exhibiting problems emanating from sacroiliac joints. So although his pain was so severe that his mobility was very badly affected, and he contacted surgeons who looking at the problem suggested surgery, and from that point onward Paul came to me for a second opinion, and we took up his case and we started doing special injections like radiofrequency to his facet joints, and we did some epidurals to just calm down the inflammation around his nerves and reduce the compression, and all was working well. And then his pain progressed to his sacroiliac joints, especially the left one, and we treated it with radiofrequency denervation, and which gave him significant relief, but still the relief was not complete. And then we brought him for IDD therapy, or the decompression of his vertebral disc therapy, and in which he has progressed significantly, and I think he will continue to progress.
So we started off with, I think it was cortisone injections into my back around various vertebrae that were causing me pain. And they worked for a period of time, but wore off after a number of months. And then I tried, also Dr. Hassan, a thing called radiofrequency denervation, where they try to burn the ends of the nerves to give you pain relief. And that also worked, but again it was a temporary relief. And that's what brought me then to the American Spine Center. Dr. Hassan Sheikh recommended I take a course of IDD therapy, which I'd never heard about, and then once I came here and realised it was very painless, actually quite relaxing. Sometimes when I'm on that table being stretched, it's so gentle I almost feel like falling asleep. But it's been quite remarkable. The treatment has been, I think, 20 sessions of about 30 minutes a time, and the pain relief that I now have is quite remarkable. I can walk for an hour or so without feeling any great pain. My daily living is much improved. I take far fewer medications to kill pain, reduced probably by about 200% in terms of number of tablets I need to take. So the IDD treatment is fantastic. I would recommend it to anybody that it might apply to.
The American Spine Center. Excellence in pain management.